He's signing a death warrant for anyone over 75. Older adults are sharing how they feel about Dr. Oz potentially overseeing Medicare. BuzzFeed. I have never been afraid of treatments not being available to me until now. Below are your comments. I'm a retired federal government employee on Original Medicare B. When I left Government, I was told that in order to take my Government healthcare plan into retirement as Seiko Nadari insurance payer, I could not elect an Advantage plan. The FERS retirement plan I have is the same one Congress has, with the except, see more. If you're currently on a Medicare Advantage plan and decide later to go back to traditional Medicare, be advised that to qualify for a supplement plan, Medicare covers 80%, supplement remaining 20%. You must undergo medical underwriting. You could very well be rejected by supplement plans due to pre-existing medical conditions. My doctor, along with many other doctors, does not take disadvantage programs. My husband and I took traditional, supplemental, RX. My husband had serious illnesses that required many doctor visits, along with many meds, Dr. Apo, ointments, surgeries, and dialysis. We didn't have to touch retirement because everything was paid for. Do we pay a lot monthly for it? Yes, but you will pay higher now or much higher later. It's your choice. We pick the doctors of our choice, not someone on a list. We just had to give up some fun things in retirement, but health comes first. Without health there is no retirement. I am 85. My wife is 82. When I retired I kept my Blue Cross plan I had when I was working. We are also on Medicare. I am an operating engineer, local 3 member, have been for 59 years and I hope I never have to depend a Medicare Advantage plan. It is an inroad to privatizing all Medicare. I wouldn't trust this man to operate on a hangnail, and I sure don't trust him to run 2 of the most important healthcare programs in the country. The very fact that Trump endorsed him for a Senate seat and then appointed him to this position is more than enough reason to believe he will be more interested in increasing his bank account as he is in providing decent healthcare for millions that can't afford high-priced. As a medical biller, traditional Medicare and a supplement are the way to go. It saddens me when I have patients call and they don't understand that they even signed up for an Advantage plan. Or they have unexpected costs that they have no idea about because of their Advantage plan. It is really sad and unfortunate. When I applied for Medicare 2 years ago, I turned down all the Medicare Advantage options I was offered. With all the money they were spending on advertising, I figured they wouldn't have any left over to see over medical expenses. I did quite a bit of research. Every individual or couple has a different situation. With my wife and my medical history, we are far better off with Medicare supplements than Medicare Advantage. Don't remove what for some folks is the better option. It's bait and switch. My wife worked in a doctor's office in the billing department and would never switch to an Advantage program. They traditionally deny medical treatments that are routinely approved by traditional Medicare. As long as you're well, then enjoy your Advantage plan, but don't ever get sick. Our state representative told us that Medicare Advantage is fine as long as you are healthy. But when you stop being healthy, it isn't easy to switch to regular Medicare. We decided not to bother. When something is free or low cost, there's usually a catch. Medicare Advantage plans sound so good until you really need medical coverage. Do you want an accountant deciding whether you need a procedure or your doctor? It didn't take long for a Medicare plan salesman to talk me out of a Medicare Advantage plan. Took him about 20 minutes to convince me to stick with traditional Medicare and a Plan G supplement, costing an extra $138 a month. For those of you who are still uncertain about the difference between regular Medicare, aka Original Medicare, and Medicare Advantage, here it is. With regular Medicare, if it approves a treatment or procedure, you're covered. Snap your fingers to accompany that statement. But since it doesn't 100% cover the cost, you'll also want a supplemental insurance plan. With Medicare Advantage, if regular Medicare approves a treatment or procedure, you can't just go in. Do you get it? First, you must submit it to the insurance company which underwrites your Advantage plan, and they say and decline you're getting it. Or they can take their time in approving it. They try to entice you with a lot of benefits to sign up, but do you really want your health decision to be in their hands? I'd say, run a mile from Advantage plans, just like I did. I've had open heart surgery, prostate cancer surgery, lung cancer surgery, and lots of follow-up treatments. My premiums are higher than Advantage ones, but my medical bills, with the best supplemental plan, $0. I feel great, thanks for asking. Oz is the equivalent of taking all the elderly to the cleaners, and I'm sick of it. Putting Oz in charge of Medicare is hiring the fox to guard the henhouse. When will these gullible voters rid themselves of representatives who have no intention of representing the electorate? The health care plan available to Congress is nothing special but has been subject to many rumors about it being free and extensive. The rest of the comments ring true, but a simple online search will give the details of Congress's place. We have Plan N because where we live, all HMOs are a long ways away, and that is what Advantage plans are. We'd have to drive a minimum of 3 hours one way just for a doctor visit, in winter, maybe longer. Where we are at now, it's a 10-minute drive to see our doctor and hospital, a not-for-profit group. It is imprudent for seniors to stay on Original Medicare. When seniors opt for Medicare Plus, this gives Medicare to the private insurers. Free stuff is not worth it, and they are using it to privatize Medicare. Only take Original Medicare. Have Kaiser's Medicare Advantage plan. Live in Los Angeles and have not had any problems. PLS have had hip and knee replacements as well as other operations. The plan worked just fine for me. Can't speak for others. I have had Medicare Advantage plans for years. Yes, some of them were terrible, too, but the ones that I have now are fine. They cover my medications and my treatments. Thanks to the hospital I go to, I have no copays. I suppose that will change in the future, but right now I am going with what is available. Anyone who is happy with their Advantage plan has only needed it for preventative care. When you really, really need it, they will find out how badly they have misjudged it. Especially when you need to see a specialist. By then, it is too late to get into the Medigap plans without being rejected for pre-existing conditions. Those are numerous and include things that would surprise you. This is avoidable. Do at least the minimum homework, not just look for the cheapest before you decide. If you don't, you will definitely wish you just had parts B and D, at least if you cannot actually afford the Medigap supplement, which is not really that expensive, depending upon the state you live in. Many of them have high deductible options as well that are still a lot better than Advantage plans. Having your choice of any doctor in the USA is important too. United States has the worst healthcare system in the world. Insurance companies raking in billions in profits to pay for people's healthcare. I'm 74 and have always used Medicare plus supplemental insurance, aka Medigap. God, if there is a God, help us if we lose the right to have Medigap. Project 2025 gave us their plans. You destroy government agencies from within by putting people don't believe in the government agencies and want it eliminated in charge of said agencies. Lou K. at Trump cabinet, he apparently had someone read Project 2025 to him with small. The Advantage plans charge the government high administrative fees and cost the government much more than regular Medicare. As former Congressperson Katie Porter, with the whiteboard, said, if we weren't paying those administrative fees, regular Medicare could afford to cover dental and hearing aids, too. Another TV person, who sold snake oil while on TV, heading up a government agency. I have an Advantage plan. It only covers in-network, which is my area with specified doctors and locations. Appointments take forever, and if I need a doctor out of network, such as when traveling, I have to pay. Why the bulk of the charges? I'm thinking about going back to plain Medicare. I'm a senior and I've done my homework. With Medicare and a supplement, you can go to the best hospitals and see the best doctors anywhere. Hat accepts Medicare. Medicare Advantage offers the sizzle. When you need something big, the insurance companies don't want to pay. Millions of people have found that out. Of course, Drive. Oz's appointment signs a death warrant for thousands of seniors. An unacceptable and wrongly opinioned charlatan has been placed in charge of their health, but Americans in general do not care, and even the GOP politicians shocked and disappointed with Oz won't say a word against him. The character of our country has sunk to never seen before low. Please subscribe to my channel. And if you like it, please thumbs up.